Hey guys, I know it's been a really long time since I've posted anything to YouTube. I've just got an incredibly busy lifestyle. Um, so yeah, apologies for that. But I just wanted to share my birthing story with people because I know when I was pregnant, at first I didn't really think about it. I guess because I was busy with my career, but it was coming to the end of the year and my contract was about to finish. And yeah, I was so busy with that. I was just like, oh, cool, we're having a baby, but I didn't really think much about it. I know that in the past, I was always thinking, oh God, it must be such a painful experience. I'm never having a baby unless, like, well, no, not never having one, but I don't want to experience childbirth the way a lot of people do. I'd rather have a C-section. That was it. I was like, sign me up. That's how I'm giving birth. And I didn't actually realize how intense my fear was until I think a couple months or a few months into my pregnancy. I discovered I actually do have tokophobia. It's like a kind of like a fear of contracting or fear of giving birth. And there are other people out there like me. On top of it, I have emetophobia, so I get terrified if I'm ever about to spew. Fortunately for me, I don't spew very often. It's like maybe once a year, twice a year, if I'm unfortunate. So we all know that with childbirth, you may experience vomiting or nausea. I'm not talking about the morning sickness part, which I was lucky. I didn't get any of that. I'm talking about when you actually go through birth the way that most people opt in for, the more natural way. And so I'm like, oh gosh, two different fears, pain, vomiting. Don't like either of them. My fear of pain and why I was so terrified of giving birth through your hoo-ha is because I've had 3 very painful experiences in my life. One of them I've done a video on my channel, which I've had a lot of comments on because other people have had the same experience. I had a corneal abrasion because of my cat's tail flicking into my eye, which ended up becoming recurrent corneal erosion. But that's all under wraps now. That's gone now. My eye's sorted. I did get another abrasion in the other eye thanks to my son, but that got fixed. It didn't even get to the stage of recurrent corneal erosion. I know a lot of you have been asking about my eye since then, the first incident. So yeah, second eye healed really quick because I told the ophthalmologist, and they're like, okay, since that eye is prone to recurrent corneal erosion, let's treat this eye a little bit differently. And it was a bit more intense, the amount of lubrication. I had to put it in like every hour. But anyway, we got that under wraps. So yes, corneal abrasions are extremely painful. I had an ophthalmologist tell me, as I've said in my previous video, he's seen grown men cry from it, and he said, I don't know what childbirth is like, but this is one of the most painful things you'll ever go through. It was really painful. So that, and I spewed up the night, I think it was the same night I got the corneal abrasion. I don't know if it was from the pain or something else, but I associated it in my head with the pain. The second and third experiences were both really bad period pains, which I've never experienced period pains like that before. I don't usually get period pain at all. But these two were so bad. I was like crawling on the floor and then I spewed up and stuff. Like one of them, I was out with my friend and I ended up on the floor of a petrol station. Very classy, I know, but I could not get up. I was in that much pain. So I've been traumatized by those 3 experiences, and the thought of childbirth being probably even more painful than that, hell no. I'm not pushing if I can't move from pain and fear, especially because it kind of goes hand in hand with me with vomiting. I don't know, if it's really painful, vomit comes in. So I was starting to get more and more petrified, but what was really amplifying my terror was me being a silly person and going on Dr. Google. So I should know better from all my university training. Like, I've done a hell of a lot of study at uni. I know that you should only listen to the professionals, look at the studies, robust studies and things like that. Why are you looking on Google and individual people's very subjective experiences? And, you know, they say, I ended up getting a social worker. I've never had one before, but I actually opted in at the hospital. She was brilliant because I was so terrified, and she helped me through. Anyway, as she said, I'm pretty sure it was her that said it, it's usually the most disgruntled people who want to whinge that come on the internet and share stories and whinge. And that's what I did find. I found a problem with every method of birth. So, the people on the natural bandwagon, or when I say natural, I mean like the vaginal delivery. I'm not necessarily talking about they didn't use any drugs or anything. So, there were so many people, oh, I tore down there, it was really painful, I had this complication, it was terrible. Then you had the people with the induction stories, and they're like, oh gosh, induction's terrible, stay away. C-sections had the worst rap of all. Oh my goodness, the amount of people being negative, and there were many people who actually didn't even have the experience of having a C-section, and they were bad-mouthing it. Heck, there was even a guy I saw on there. I mean, what business is it of yours saying you didn't really give birth if you had a C-section? Not to me, but I saw it out there. Because I was obsessed. I was a crazy woman looking pretty much morning till night at all the stories I could find about people giving birth. I was that petrified. I joined groups on Facebook and stuff. Actually joined a really good one. It was, I can't remember, C-section by choice or something like that. So anyway, I actually know people who I trust who have had C-sections. And the reason I initially said, if I'm going to have a kid, I'm going to have a C-section, is because I was actually there and I saw, I remember clearly actually one of them coming out of the theatre had their C-section totally fine. And yeah, I've spoken to people who have had C-sections, a handful, and they were like, what pain, what are you talking about? And I'm like, oh, but everyone on the internet and people I meet in real life, they're telling me it's terrible, stay away. Like, that's not even a reality. For those people, that was not a reality, and they said they'd pick a C-section again if they had to. And they, I know that one of those people actually elected, and their obstetrician actually said it's the safer way to bring a baby out in the first place. In fact, my obstetrician, who is very well known, as one of my neighbours, gosh, even my neighbours have been delivered by him, says, yeah, everyone uses him. He's very, very well known private obstetrician. I actually had a brilliant public one too. I went collaborative care. I'll get to all that in a second. But my private obs actually said that the College of Physicians, or whatever one of the governing bodies or something, are actually going to have to start giving information to patients about the risks of vaginal birth. Because don't for a minute think that there's not risks with that. Just like C-section has risks, I'm not going to be one of those horror story people going, oh, stay away from, vaginal birth. I'm saying that doesn't matter if you do induction, vaginal, or C-section. I'm not talking about pain. I'm not talking about the experience of it. I'm talking about from a medical perspective. All three will have risks. And I'm saying this not out of my own mouth. It's an obvious fact. You can go talk to your professional and they will tell you. Or you can go look at authoritative sites, not just Google and random blogs from random people. Or look at authoritative sites and you'll see, like every procedure, or even taking a simple Panadol, has a risk for certain people. Although a lot of the time the risks are small. So for example, my public obstetrician said, I think the infection rate of a C-section, which was the biggest complication that he seemed to think was the most worrying, if you want to call it worrying, is like 10% or something like that. And no, I didn't get an infection. So stepping back. So as I started to read more and more and become more and more terrified, I got to the point where I could not sleep without ruminating and then getting onto my phone in the middle of the night and trying to find people's experiences. I lived in terror. I had never been that scared in my whole life. It consumed me. I lost pleasure in doing anything. I had such severe anxiety. I thought that, I just wanted everything to be over. I didn't want to give birth. I was so scared. I was like, I wish there was a way out. But personally, I don't believe in abortion. So that was not an option for me. So I went to my public hospital, which is where you go first if you don't have private health insurance. And I was like terrified, and I told the midwife that I met with, can I please get a C-section? And at that stage they were like, yeah, they don't really want to encourage that at that stage, but they were like, they realized that I needed some extra support. I can't remember how I got onto the social worker. Maybe they mentioned it at the first appointment. I cannot remember. And I'm sorry if I miss a few details here and there. I know that you could do a self-referral though, so I did talk to the social worker. And I told her about another one of my fears. God, you guys are going to think I'm like scared of everything. I actually can't do number 2 when there's people around, or if I have to share a toilet with other people who aren't like people that I'm really comfortable with, like my husband and son. So that's actually called parcapresis. So I said to the social worker, like, I've got this difficulty. I know it's a public hospital. I'm not going to get my own bathroom. What they do at this hospital is you get your own private room when you've given birth, but you have to share with one other person. So she was going to help with all of this, and I said how terrified I was of childbirth, and could she advocate for me? I want the public hospital to give me a C-section. And I know that a few years earlier, I had actually gone to see a GP, just mentally preparing, going, hey, can you ring up? This was another hospital in Brisbane. I'm like, can you ring them up and just ask, would anxiety be covered as a reason to give an elective C-section? She rang up in front of me and they said, no, we'll be pushing for like a normal birth or whatever you want to call it. I think C-section is also normal. I don't know. I just call it normal because I think that's just the one that most people pick. So your regular birth, I guess you could say. So I was like, oh gosh, that's scary. So basically I'm going to need private health. But I didn't get private health. And I just left it, and so we, just one night of bravery, I said to my husband, let's just try, because I knew my husband wanted a child, and I was like, yeah, it could be cool, but it's terrifying. And yeah, I got pregnant pretty quickly. Like, it was not hard at all for me to get pregnant, and I didn't have private health insurance, so and even if I got it then, you'd have to go on there's a waiting period before you can even use it for things like pregnancy. So I was screwed unless I wanted to fork out about, I think it was like $7,000 to $10,000 or something like that. So yeah, we stuck with public at first. Yeah, so as time went on, I was still petrified. I just, like I said, it consumed me. I don't even know how to explain how terrorized I was every day. I was like a zombie. So, fortunately for me, things took a really good turn. So, just going back to a few stories before I go on to the good turn. So some of the things I'd read were like horrifying. I had read that a C-section is so agonizingly painful I saw one person on YouTube saying that she was crying with every step she took. I was told by like a neighbor down the street, her C-section was horrible and she was on narcotics for like 1 or 2 months or something like that. And then even she was like, I would try for an induction first. But then people also talk horror stories about inductions. And my obstetrician, the private one, said it's a big question mark. You don't really know the outcome with an induction. You may end up in a C-section anyway. So yeah, I heard it all about C-sections. People just absolutely made me feel terrified. And you know, the negative comments about a C-section is really uncalled for if you haven't had one. And I know there's a lot of people who are advocates about this is how your body works, you know, but you got to realize mental health is a real issue too. Like if you can't do it, you can't do it. And you know, we've got advances in medicine, you know, so get with it, guys. Like we're not living in the Middle Ages anymore. Like you have options that are really safe these days. As my obstetrician said, C-sections are a very well trodden path. Okay. And no, he wasn't one that pushes for C-sections. He would be happy to give any kind of birth. That was not an issue for him. Before you go, oh, private obstetricians want to go play their golf and get the birth out of the way. No, not like that. Anyway, so terrible stories, very discouraging. And I'm not saying their experiences, the people who actually did have a C-section and spoke about it, I'm not talking about the ones that just bad-mouthed it and said that it's going to be so painful and stuff, or it's major surgery and stuff, which my obstetrician was like, yeah, major surgery, yeah, you know. But not really. Like, not for him, probably it was like he could probably do it with his eyes closed. He said he'd done about 1,000 of them. But, and he said to me, you know how much blood you're going to lose? Like, he was like, I don't drink, but just the comparison was like a wine glass full of blood. He's pretty skilled. And as one of the midwives said in the public hospital, she said, yeah, he's pretty quick compared to the other obstetricians. Like, he doesn't leave people on the table very long. He's like 20, 30 minutes done, you know. So, and my experience was from memory, he was pretty damn quick. Like, it was just such a blur, it just happened. But anyway, I started talking to health professionals, which is what I should have done in the first place, telling them how terrified I am, talking to my social worker, talking to my psychiatrist. I was that terrified. And, you know, what the consensus actually was is, you know, they can't tell you what to do, but the consensus was this. Let me give you some of the comments and you figure out what the consensus is. So the head of obstetrics at the public hospital, she was told about me. I was like a special case. I was that terrified. Like, most people are a bit like, you know, chill. Oh, I'm having a baby. I don't care. I'm going to get a doula. I'm going to have a home birth, whatever. I was like crazy about it. Anyway, so she actually said, look, if she's not going to be on board, she pretty much says she's not going to be on board for a regular birth. And public hospitals usually go for the regular birth. They try to not go down the C-section path. I don't know if it's cost or the risks or which risks you've got with a natural birth anyway. But they usually try to encourage the, hey, let's just do it the routine way. And I can imagine it would cost more to do it surgically. I don't know. That's just my guess. My guess is as good as yours. So, yeah, so she was like, look, she's not going to be on board. She's not going to be there, right? My public obstetrician, which was assigned to me, he was so kind. He's like, we're going to take good care of you. Don't worry if you want to stay 1 night, 2 nights, 3 nights. You want to stay 1 week here. That's fine. And, you know, that's really generous, especially at a public hospital. And he said to me, look, it's better it's better that you end up, if you don't think that you can push and you're not going to be on board with us, then it's better you end up in a planned C-section than an emergency one. And I have heard that emergencies are harder to recover from. And my private obstetrician was like, look, we think we know what the path is for you, right? Especially when it comes to anxiety. People with anxiety don't like surprises. They like things very well known what the outcome is. So I spoke to like a GP and I said, oh my God, I'm terrified. And I was bawling my eyes. And I'm like, you know, I've heard C-sections are so painful. And he's like, are they? He was really cool. He's a really cool doctor. I actually really admire him. He's not only got a medical degree and practices as a GP, he's also got a PhD in medicine. So he's a doctor. Plus he's got a pharmacy background as well. So wow. So I really respect his view. So trying to cut this a bit shorter, basically what they did was they planned with my private obstetrician and the public system, they planned to give me the head of anesthesiology to do my spinal. I had a meeting with the anesthesiologist, the two heads, and I bawled my eyes out to them. And they're like, we're going to do the best we can. And as my private obstetrician says, no one can tell you, no anesthetist is going to tell you you're going to have no pain. They can't do it. But they will underestimate they will go beyond what they tell you they can do. How am I saying this? I don't know how to say this. Like, they will promise you something small, but they'll over deliver. I guess that's the thing. And like, if I had listened to all the people, like the midwives and stuff, like, I mean, there was one midwife that said, oh, so much pain after a C-section. And I started bawling my eyes out, and me being scared of vomiting, I had such heightened anxiety. I was having a panic attack. I spewed in the social worker's office with the midwife there, because they assigned me in a public hospital, private midwives to help me through my journey from fear. Like, the public hospital gave me two of their midwives, and one of them was like the head of midwives or something. She was absolutely lovely. Anyway, but apparently I had a panic attack before she could finish. What she wanted to say is they can control that pain. And what my private obstetrician says, he's like, pain? No, I remember this. Discomfort? Yes. And you should. I spoke to so many midwives. I'd call up in the middle of, like, not middle of the night, like at night time and stuff. I'd call up and be like, oh my God, what's this drug like? What's that drug like? Because I've never had high-end painkillers, which is what they're supposed to control the pain with. And I was freaking out. And I was scared they'd make me vomit or they wouldn't work. And they would say, like, you know, your pain, and the midwife that really was on the journey with me to the very end, she came into my delivery, the pain should be around a 4 out of 10. That's what they aim for. So I had the C-section scheduled. So I actually didn't need one per se. I could have gone down the vaginal birth because all my blood tests, as my doctor said, my obstetrician said, I'm flying through my blood tests. There was no complications, nothing, right? So I was scheduled. They said, we'll do you first thing in the morning so you don't have to wait and be anxious. And you're probably wondering, hey, how did you get a private obstetrician to deliver you in a public hospital? Well, I did the collaborative care, so I had best of both worlds. And he actually has insurance to practice on a Thursday at the public hospital. So pretty much it would have to be a C-section if you want him to do it at a public hospital, because he can only do it on a Thursday. And you better pray to God you don't come early or late and it doesn't fall on the Thursday. So, but he said to me, you know, first time you'll probably be late anyway. So I'll be there. We're delivering you. And that's what happened. So I ended up having so many things to help after discussions with the anaesthetist, my private obstetrician, my public obstetrician, my midwife, everyone. They came up with a really good plan. So what they did was, my private obstetrician did some things for me that usually women don't end up having when they get a C-section or anything, or especially in a public hospital. He gave me tap blocks, so he put 2 injections on either side of my scar, which lasts for hours, and it really numbs most of the pain down there, right? On top of that, the dressing he used for me was a Pico dressing, which one of the nurses, midwives at the public hospital was like, oh, that's fancy, we don't often use that one. They usually use that more in a private setting because it's probably more expensive. It suctions your wound, and it's got a battery pack attached to it. So you can take a shower, just make sure the battery doesn't get wet, and it suctions your wound for like 7 days. So, you know, some people buy those recovery shorts. My obstetrician was like, you know, that's better than that. It's supposed to help with wound healing, and I didn't end up with any infection. I healed really well, although because I don't know my skin type or how I heal, I'm prone to keloid scarring. So he did say to me, look, in 6 months you probably will struggle to find the scar. For me, unfortunately, and I did speak to him about this, that wasn't the case because my body's prone to keloid scarring. But he said, like, if I have another C-section, it's easy. Now that he knows how my body reacts, he can just cut out that scar and he can inject steroids into it so that I can heal better. That's appearance-wise. Healing-wise, physically, oh my God, it was really nowhere near as bad as people made it out to be on the internet. My obstetrician even said, look, if I had $1 every time someone walked through the door and said that wasn't that bad. So anyway, so on top of that, so they put the spinal in my back, which I'm not sure what drug it was. I can't remember. I can't remember if they said it was morphine or maybe it was the fentanyl. I don't know. But then, so that's pretty standard. And that covers you for like 24 hours. What they put in your spine covers you pain-wise for, about 24 hours. But then, on top of that, most women are not given a PCA. But I got permission, because of my mental health, to get a patient-controlled analgesia. You can't overdose on it. Basically, you click a button and it releases the drug they gave me, which was fentanyl, an opioid. And the aim was, to use it only if you need it, and it will lock you out at certain times so you don't overdose. And basically, the idea was, like before you're going to get up and move, click it so you got some extra pain relief. It was funny because one of the anaesthetists came and visited me the day after my C-section. They saw how many available clicks I had, and they were like, oh, gee, you didn't use much. And that's true, because at least for the first 24 hours, I felt zero pain, literally zero. I was like thanking my lucky stars. 5 hours after the surgery, because that's how long it took to feel my legs, it was about 5 hours, I got up. I was terrified because everyone on the internet was saying the first time you stand up is so painful. Even someone I knew who'd had a C-section said, oh my God, it's really painful the first time. I was freaking out getting ready to stand up. I stood up and I was absolutely jaw-droppingly shocked. I was like, oh my God, this is amazing. I felt nothing. I felt like I hadn't even had surgery. I felt a bit slow, but that was it. I literally walked down the hall because I wanted to find my social worker, but she wasn't working that day. So there was no problem. There was no problem. All those horror stories that made me miserable for months was a waste of my time and a waste of my energy, and I had bad depression and anxiety because of those terrible stories people in real life and people on the internet would write, and I wish I didn't listen to it. I wish I had listened to my social worker, and who said stop Dr. Googling, and I think other professionals said to me, don't Dr. Google. My psychiatrist said to me, oh, please don't Dr. Google. I can't remember what it was about, but he even said, look, if you look up Panadol, you'll find, he said, you know, side effects of that. So I'd like to add that on top of what was in my back and the tap block and the really good dressing, which really sucked in my wound, I also had round the clock, which is pretty, it seems, standard from stories I've heard, an opioid round the clock plus like an oral opioid plus buprofen, kind of like Nurofen, that's the generic name, and Panadol around the clock. And before all this, I was like, oh my god, Panadol barely works for a headache for me. But my obstetrician's like, you know, when you use buprofen and Panadol together, like, it's really good. So I had all three of them around the clock. So the opioid that was given to me is more modern than what some hospitals use. Some hospitals use, I cannot remember the name, but I've heard a few people be given that one. But what my obstetrician gave me, because he said that one's a bit outdated, he gave me Targen. So Targen has, I think it's the drug naloxone or something in it, which actually counteracts the negative side effects of opioids. So with opioids, you can get constipation. And obviously after surgery, you know, your intestines can become a bit sluggish. Not that he goes anywhere near your intestines. As my obstetrician says, nothing comes out. He doesn't remove anything out. He does everything internally, and he says intestines are disgusting. I don't go near the things. So it's not that. It's just, you know, things have slowed down. Just physiologically, there's reasons for this. But I know that, again, from what other people have said, there's been constipation issues. I had constipation, but what I did was I took stool softeners pretty much from day 2 or something, and I can't remember. I think maybe I had some pear juice or something. I can't remember. But I did little rabbit pebble poops, and they said, oh, that's actually pretty good, especially considering how much drugs I had in me. You know, they really slow down system. And see, on top of that, I had 2 antiemetics put into my back because of my fear of vomiting, because they actually said to me, you know, the anaesthetist said your blood pressure can drop when you go in it, when during the C-section procedure, and it can make you nauseous and want to spew, in which case you'll have to turn your head and spew. But they put two antiemetics IV, into my back with the spinal, or maybe it was through my hand. I can't remember. I just know that they put 2 antiemetics into me, which also caused constipation. So I had a lot of things going on. Took me day 5 before I did a really good poop. Too much information. My mum cooked me this really good Persian soup with lots of vegetables and stuff, and it felt like I was going to tear my butt. That's how big and hard the poop had become, even though I'd done little micro poops a few days before, which was another fear of mine. I'm like, oh my god, what if they need to try and get the poop out of me, because I'd become really fecally impacted. But yeah, so there are things they can give you, laxatives and stuff, and I probably didn't use the full spectrum of days to use laxatives. I probably could have. Maybe that would have improved things. But yeah, so pain-wise, the other thing I was told by my obstetrician is, you know, like athletes, they rotate heat packs and ice packs. That's what he said to me. So I can't remember if I used the heat packs much, but I used the ice packs a lot. So I would put an ice pack on my scar so much, like quite regularly, and I'd get those ones that are like you snap them and they're instant cold. The hospital had given me one before, and I remembered that, and so I ordered the same brand off, I think it was eBay. I've got a whole bunch of them from Fear leading up to the event, and I'm glad I did, because going back to the pain issue, so like I said, the first 24 hours and even longer, I think it was, I felt practically zero, nothing. After that, after the tap block started to wear off, the spinal started to wear off, my PCA was taken away from me, because they don't want to keep you hooked up to a PCA, which you can press a button for more than like 24 hours. They took that away from me. So then what was left is I had the really cool suction wound care, and I had my Targen opioid twice daily, so around the clock. Same with my Panadol or paracetamol, whatever you want to call it, and ibuprofen around the clock. So I had those 3 remaining. So some pain started to appear. When I say pain, and this is, I've seen like other people with my fears with tokophobia react to other people. When I say pain, let me be very clear to you. It is nothing like, if you're scared like me, it is nothing like what people are reporting. Maybe for them it was, but I'll get into that in a second. It's, if you have the right tools, then yes, you will feel some pain. It's like if you cut your finger, let alone a big cut, like, you know, down there to get a baby out, you're going to feel some pain. But by pain, I don't mean It's like a different kind of pain. It's not even a period pain. I didn't feel the contraction of the uterus going back down to size. I actually didn't feel that at all. It's kind of like a stingy pain, like a cut pain. You've been cut. That's what I felt, a sting. So what helped me was walking with an ice pack on my scar, like really like pressing it down on my scar. That only lasted, that level of pain, which was nowhere near horrible, nowhere near. That level of pain lasted, I'd say, a few days. That was it. That was it. They say you get clearance for driving after 6 weeks. I wanted clearance for driving before 2 weeks. This is the girl who is petrified of pain. I was dying from fear. Anyway, I got my clearance after 2 weeks. That's the earliest I got my clearance. I was totally fine. I had no problems. I would definitely pick a C-section again. I don't even want to bother going down the vaginal birth because that is hours of pain. They can only, like if you go with morphine, I was told they can only give you 2 shots of morphine. That's it. And if your labour's over a few days, well, they can't, they prefer not to give you an epidural until you're dilated to a certain number of centimetres, which for some women, apparently, according to the midwives, you know, some women handle that fine. Some women find a dilation of 2 or 3 very painful. I didn't want to risk that. I didn't want to risk any pain at all. Didn't want to vomit. Didn't want to go through potentially days and then potentially end up in an emergency C-section because it is an unknown. If all goes to plan, cool. And kudos to you if you can handle that. I mentally couldn't, right? And one of the midwives actually said Asian people, which I am. I'm Middle Eastern. There's no such continent as the Middle East. So technically I'm Asian. Asian women, she said, have more chances of 3rd degree tears. I don't know about 4th. But yeah, 3rd. I'm pretty sure, she said. So I didn't want to risk all that and then having to have pain, having to go trying to pee, you know. And one of the Facebook groups I mentioned earlier that I was like about people who C-section by choice. Though there were, you know, still some people talking about pain, there were quite a few people saying no. And one of them sent me pictures. I don't know this lovely person from somewhere in the world. She's like, look, this is a picture of me the day after my C-section, no pain. And she's smiling and happy and stuff. But those stories were few and far in between. Most people would try and make you feel really scared. And they're like, how can they enter? I actually shared my story on one of those birthing groups, and they pretty much tried to, one of them say I'm lying about the pain. This is my experience. What benefit do I have to lie about it? Like, she was like, how can you say you had no pain after major surgery? Well, no, I didn't, because I had all the tools that modern medicine gives you. And yes, there are many people who may feel pain. I'm not denying that at all. But there are so many factors. How experienced is your surgeon? How many C-sections has he done? What method of C-section does he use? I remember I was so scared. I was looking at the different types of surgical techniques. I even suggested one of the surgical techniques to my obstetrician. He was like, nope, I don't use that technique. I'm not doing it. He had his way, which I'm glad he did, because whatever he did, he used magic. And he said to me, the key is to cause as little tissue damage as possible. And as I take very good care with every patient with the amount of tissue damage he tries to avoid. So again, then surgical technique. What underlying health conditions do you have? I'm a pretty healthy person. I've never drank alcohol in my life, never taken drugs. So I don't really have any health issues. I have minor thalassemia, which is to do with my hemoglobin, which Mediterraneans and Middle Easterns, it's common in some of those people. But that's pretty much it. I had anxiety, depression, but my health was pretty good. So again, underlying conditions, do you have any? Are you tolerant? And this is another thing that I found out. They're like, these should work on you because you don't have chronic pain. So people with chronic pain, sometimes they're actually tolerant to painkillers. For me, I had no experience with opioids prior to the childbirth. So for me, it made me so drowsy, but it worked because my body was not tolerant to it. It really had an effect on my body. So again, have you developed tolerance due to some chronic pain issue that you already take pain medications for? So see all the factors that may make some of these stories a reality for some people, but what they don't share with you is all the factors around why maybe they've had this pain. What are the lurking variables, as you say in statistics? It's really unfair when people are, well, not everyone, people like me, people who suffer from tokophobia or emetophobia, when people come across these stories and are really discouraged by a certain path they've chosen, because, certain people share a negative experience, but they don't give you the full picture that may not actually be your reality. And when you've got such heightened anxiety, you can't really think clearly and objectively. So you're kind of like believing, kind of like confirmation bias. So for me, I'm like, it's going to hurt. I'm going to find things, that are going to back me up mentally. Even though I was also trying to find things to prove me wrong, but my confirmation bias, I guess, took over, I guess you could say. So again, they're just a few factors. Also, what type of dressing did they use on your wound? Did you have something to suck in that wound, or did they just use stitches on you, or staples, or just glue? Again, all these factors contribute. Did they give you tap blocks? Were you lucky enough to get tap blocks? Did you get a PCA? Did you take your medication on time? Because you have to take it on the schedule. Because if you miss it, it's actually hard to catch up on the pain. Mind you, they actually gave me, because there's something called breakthrough pain. My obstetrician said it's unlikely, but it does exist. So that means the pain has broken through the opioid. Even if you're having it on time, on schedule, it is possible for pain to break through. In that case, they went the extra mile for me again. They said, here's a prescription for endone. And that's like a fast-acting version of Targin. So have that. In the meantime, it should take 20 minutes to kick in if the pain breaks through. I didn't even bother using it. My midwife was proud. I didn't need it. But, so again, look at all the stops there are that can contribute to having a not completely pain-free, but a pretty tolerable level of pain. There are many factors. I probably haven't even covered them all, but this video is getting a bit lengthy. So just keep in mind before you try and discourage others, especially if you haven't had a C-section and you're saying it's not good, you don't know this person's circumstances, you don't know who's going to be doing their surgery, what experience they've got, what their anesthesiologists are like. There's so much to it. How much help they're going to get. So my husband really helped me when I was in hospital. He did pretty much all the lifting and stuff because I was asleep all the time. These drugs do knock you out. I did get up and try to walk as much as possible because I wanted more blood flow and I wanted, to recover as fast as I could, because that's just, since I grew confidence after the first time I stood up going, oh my God, this is totally fine. I grew confidence and I'm like, I want to keep this up and I want to not become stiff. I want to move around, continue to feel this good. But my husband did practically all the nappy changes and stuff and the midwives and stuff. So again, that's another factor. Are you by yourself? Do you see how there's so many factors before you go and discourage someone? Because I really don't think that it's cool that C-sections have a bad rap, especially maternal request C-sections, which mine was. Now, a really cool twist to my story. So I'm very religious. I'm a member of the Baha'i faith, and I really believe in the power of prayer. I also believe science and religion must agree, because that's one of the principles of my faith, that science and religion go hand in hand, and you should, go by what the competent physician tells you. So the gist I was getting from all the professionals, the psychiatrists, the midwives, the obstetricians, everyone was like, you're probably not going to be on board for this with your anxiety. Without telling you what to do, pretty much the C-section is the good path. So that, plus the power of prayer, I prayed and prayed, and the decision came to me after my prayer, and I held it. Even though I was scared and had doubt, I was like, no, this is my answer. I'm going to stick to this maternal request C-section, because I was yo-yoing. I'm going, what if a regular birth is actually less painful than a C-section from all these stories, even though the regular birth has terrible stories too? Or what about, because one option was, put a epidural in, go to sleep, wake up, after an induction start pushing. That was another option, but that's a big question mark, which could lead to erratic heart rate of the child and potentially ending up in an emergency C-section. So, I was yo-yoing between the three options: induction, regular birth, or C-section. I kept yo-yoing, but I was like, nah, I'm going to stick to the decision that came to me after the prayers and stick to what the professionals who are trained in science know. So I stuck to it, even though I was terrified to the very last moment. I turned up on the morning of my surgery. What was interesting is that my midwife told me afterwards, it's lucky that you picked that C-section, because had you have not, we would have been having a very different conversation. In other words, my son could have died. What they found when they cut me open was that there was meconium in my womb, and it had been there, I think, for a couple of days at least. And he probably, or maybe wouldn't have made it had I waited, because first births take a while. Could have been weeks before I got him out if I waited for the regular birth to happen. And it was very lucky, I was told, that scheduled C-section, I was 39 weeks and 6 days, I think. And they said, my midwife said, look, we waited that long in case you changed your mind for a regular birth. But I stuck to the decision. And yeah, I was told that was a really good decision to make. And what's interesting is actually, for those 2 days or so, I think, before delivering, I actually started to feel slightly reduced movements, and I thought, oh, maybe it's in my head, maybe, it's fine. Never take that lightly. Anyway, so the power of prayer plus science and trusting your professionals, it all worked wonderfully. I actually wish everyone the best of luck who's giving birth. Any method of birth is fine. Like, don't let anyone terrify you. You might have a painful birth. I'm not saying you won't. You might have a wonderful birth where you don't feel an iota of pain, not even a 2 out of 10. So don't listen to individual stories. Take them with a grain of salt, because I wish that I didn't spend my time ruminating over these horrible stories and discouraging words. And thank you to the people that were few and far between that were like, no, actually it was really, good birthing experience. Oh, one more thing. I didn't vomit once. The antiemetics had it all under control. The drugs do work that they give you. You should trust them. At one stage, like honestly, at one stage I was like, oh my god, they're telling me it's going to work, but it won't work. Doctors have had years of training. I think they know from experience if a drug's going to work or what the chance is that it won't work, Anyway, so yes, that is my birthing experience. I am going to end with footage of me in the C-section talking to my obstetrician. So until next time, enjoy your day, your night, and don't forget to subscribe if you like my channel. Bye.
Hello, cutie. Oh, yes. Hello. That's the way.
Ready?
Well done. Oh, you're a bit cute, aren't you? Yes, you. Hello. Hello, Mummy and Daddy. Look what you made.
Oh,
so small. Aren't they tiny when they start? Yeah. Look at those eyelashes, would you? Oh, God, I know, you're beautiful. Isn't it? Cutest little button ever, hey? That's right, you shout at Mummy. Perfect. I'm going to keep him warm, alright?